recent years, and the biggest jump has been specifically among Asian, Black, and Latino populations. Right now, we're joined by Dr. Jorge Saucedo to learn a little bit more about why this is. And Doctor, why these communities of color, and what do they need to know?
Yeah, well, one of the important things that we just learned based on the recently reported 2023 American Heart Association statistical update is that the year of 2020 was the year with the highest number of cardiovascular deaths that we have ever experienced in the United States. As you may remember, that was the first year of the COVID-19 pandemic. The previous record year was the year of 2003. As you pointed out, the largest incidence in deaths were seen among Asian, Blacks, and Hispanic people. So we think that there is a clear opportunity to address structural and social issues that drive health disparities. What are some of those reasons? Well, the larger increase in numbers of cardiovascular deaths in these communities has to do, we believe, at least in part because individuals went to hospitals during the pandemic year later as they were experiencing probably signs and symptoms of cardiovascular disease, stroke, heart attacks, etc. So there was a delay in care. But there was also, these are the populations that usually have more comorbidities. They are more obese, have more hypertension, more risk factors, etc., which also played into having seen more cardiovascular deaths during that year.
Yeah, and Doctor, if you do fall into the category of being one of those three minorities, if you will, what can be done right now to maintain a healthy heart?
Right. Some of the more important things is maintaining a healthy lifestyle, not smoking, controlling blood pressure. Make sure that you know your numbers. That is, what is your blood pressure and what is your cholesterol level? I would say with physical activity, with lower cholesterol, control blood pressure, and not using tobacco, I think in general, one would be in a much better situation than the majority of the patient population in terms of cardiovascular risk.
All right, and really quickly, Doctor, only here 30 more seconds, but I do want to ask you, when should you seek help?
Well, definitely, everybody needs to have their primary care doctor to talk about cardiovascular risk and risk in general for many other conditions. If somebody has hypertension, somebody has elevated cholesterol, that's easy to treat. But of course, if somebody has symptoms of chest pain, shortness of breath, swelling of their legs, fainting, dizzy spells, these are some of the most basic symptoms that patients experience that require for patients to go see their primary care or their cardiovascular specialist.
Okay, and that's why it's so important to have that primary doctor there, that phone number in case you do have any of those symptoms. Dr. Saucedo, thank you so much for joining us.
My pleasure. Thank you.